All right. Hello, my name is Ainsley Bale.
My name is Mara Murad.
My name is Reva Kamath,
And I'm Izzy Paul.
and we are here on behalf of our hosted chapter in Indiana to educate our community, behalf of our community awareness project on gum disease and dental hygiene. So we have partnered here with Dr. Neena Nayak-Sujir to help educate our community better on gum disease. So could you briefly introduce yourself, please?
Thank you. I'm happy to be here and talk to you about gum disease and its prevalence and ways to prevent it. My name is Dr. Neena Nayak-Sujir, and I have been a dentist in India for a short while, and then I've been practicing here for a few years. What would you like me to talk about in specific today?
Well, we just have a few questions prepared. For example, do you typically see gum disease in certain races or ethnicities?
Yes, we do. Certain ethnicities or races are more prone to gum disease than others. Asians, African Americans are prone to more issues with gums or related structures in the oral cavity versus other Caucasians or other races. Yes.
So, what are some of the symptoms of gum disease?
The mildest form is when you have slight inflammation called gingivitis or gum inflammation, and it can be seen as a slight bleeding of the gums when you brush your teeth, to severe disease called periodontitis, where the associated tissues are involved in the disease process, so much to the point where the bone is affected and sometimes people lose their tooth in extreme cases.
So what do you feel like are like the worst, like most severe symptoms of like gum disease? And how do you feel like dentists go as of like diagnosing this? Like what do you think they do to like diagnose like the least like severe symptoms and the most severe symptoms?
We have certain parameters that we follow as to determine the severity of the disease. So based off of that and radiographic findings and oral signs, we determine where the patient can be categorized as mild, moderate, and or severe. So based off of that, we are able to do some treatments, and sometimes extraction or removal of the tooth is the only way to control.
And yeah, we were also wondering what preventative measures that some people can take in order to avoid getting gum disease.
As like your dentist will always say, good oral habits, as in brushing your teeth, flossing regularly, having lots of fluids, and staying hydrated. Good salivary flow, like chewing on gum. So, eating fibrous food that cleanses your soft tissue or the gums is helpful.
Are there any lifestyles that increase the likelihood of gum disease?
Yes. When certain medications, certain genetic disorders, certain systemic issues, as well as people using smoking and vaping and also drugs causes certain systemic changes or oral flora changes that triggers or adds on to the gum disease becoming intense or bad.
All right, so like is there like a certain prevalence of gum disease like in a certain age group? And do you feel like for like younger kids, do you feel like they have a higher chance of getting gum disease because of a certain factor, and then older kids have a certain like have a certain chance of getting it more if they're doing something different? Like what do you feel like are the patterns of gum disease through different age groups, starting off with kids and then going up into older age? And how do you feel like this just like patterns you see?
Most often, gingivitis, or the mildest form of gum disease, wherein the gingiva or the gums are inflamed, is seen across the border and more common in kids. And then you see periodontium involvement as you see go into the older age group. So the mildest form is universal or prevalent in all age groups. If you do not brush your teeth, plaque develops around your teeth within 24 hours, and that will form calculus, which is a calcified form of plaque. And then that causes irritants, and so starts the cycle of gum disease.
And have you seen any specific patterns in gum disease following COVID-19 or not so much?
Yes, they have been. COVID has changed the way certain oral symptoms have exhibited in the patients that we have seen post-COVID. We have also seen uniquely the mouth dries out because of the COVID the virus, and that leads to certain forms of gum tissue diseases that we have to address. That can be categorized as COVID-related signs and symptoms.
And what do you think is like a daily thing that people do that like could cause like gum disease, or like just something that goes unnoticed? Like you mentioned plaque buildup. Like how do you know when you've like built up enough plaque to go in to like see a dentist to see if it's gum disease, or how do you know
Maybe
when it's like becoming severe? What do you think for like a day-to-day like person like us, like students who just are like living their lives? How do you know what's like the best advice you have for us to like go about gum disease and to like educate our community, as we want to just be very like broad so we can get the message across very easily and not confusing, especially if we're going to like little kids?
every time you eat something, throughout the day, what happens is the food reduces the pH of your mouth, which means it makes it more acidic, right? So organisms are attracted to that, and thus begins the cycle of plaque accumulation or buildup. If you take care of breaking the cycle, then there's less plaque buildup. So a simple act is after every meal, drinking some neutral pH or alkaline fluid is pretty good, like milk. But instead of brushing your teeth, you can at least rinse your mouth thoroughly so that food debris or food remnants are not attached to your tooth, leading to gum disease or plaque accumulation.
All right, and one last question. Do you feel like fluoride has an impact on gum disease? Could you explain a little more into that?
Fluoride?
Yeah, the usage of fluoride, like.
No, fluoride not necessarily has a direct effect on gum health, but it hardens the tooth or protects the tooth that is covered by your or enclosed within your periodontium, right? So while fluoride does not, the act of dispensing fluoride in the form of a fluoride mouth rinse or a toothpaste while you're brushing kind of massages and cleans up the gums and helps you maintain good oral health.
And for people who have had a severe form of gum disease, what does the prognosis and outlook look for them after treatment?
It depends on the severity, as well as every part of your mouth has a different prognosis, because the gum width or shape varies from the front tooth to the back tooth, right? So anterior to posterior. So based on that, and based on the involvement, the prognosis varies. But overall, with good proper management, good oral habits, frequent medical, dental health specialist intervention, you can control the periodontal diseases. Yes.
Do you think that there are any common mistakes that people often make during the dental hygiene routine that can be contributing to that can contribute to them being more likely to get gum disease?
Yes, very good question. Actually, people can brush rigorously and in a wrong manner, causing the tissue, instead of being massaged or cleansed, to be abraded or worn out. And over a period of time, the gum cannot make up for the lost tissue or cells with the vigorous brushing and other oral habits that you may have. And that may cause or trigger some gum issues which could have been prevented otherwise.
Okay, perfect. Thank you so much for your time today, Dr.
Thank you, and good
Nayak-Sujir.
luck to you guys.
Thank you.
Thank you so much.
Thank you so much. Have a great day.
You too. Bye-bye.
Bye.
Bye.